Recognizing that we are stronger together, the Community Foundation for Southeast Michigan created the Michigan Opioid Partnership to improve treatment and find solutions. We spoke with members of the group: Amanda Reed from the Community Foundation for Southeast Michigan, Michael Rafferty of New Detroit, and Julie Rwan from Vital Strategies.
Okay, so the Michigan Opioid Partnership is a public-private collaborative that includes the state of Michigan and several key philanthropic organizations who all share the goal of decreasing Michigan opioid overdoses and deaths. And so the Michigan Opioid Partnership was comprised of 8 health funders, and that started around 2017, with everyone having the mission and goal to help address the opioid epidemic. And so the Community Foundation for Southeast Michigan is home to the Michigan Opioid Partnership because of the Community Foundation's unique ability to be a home to collaborative funding. So that means we can take in money and we can also grant it out. And so the initial pilot was successful. And with limited philanthropy and state funding, the Michigan Opioid Partnership piloted a project in emergency departments, which resulted in a large grant from MDHHS, Michigan Department of Health and Human Services, to expand the work across Michigan. And then we were able to leverage Vital Strategies funding to fill in any funding gaps and put greater emphasis on racial disparities.
So the scale of the overdose epidemic is increasing from year to year. And in 2020, we saw over 93,000 deaths across the country. And in Michigan, as in the rest of the nation, we're seeing that overdoses are the leading cause of injury deaths. So more than car crashes, gun violence, and suicides. And in 2020, Michigan saw more than 2,800 deaths, which represented almost a 19% increase from the previous year. And another thing we're seeing in Michigan is that Black Americans are disproportionately impacted by overdoses. While overdose rates in 2018 decreased for white residents in Michigan, we saw a significant increase in Black residents. And we're also seeing that in Southeast Michigan, which is home to the largest, Black, Indigenous, and people of color communities in Michigan, that 25% of Michigan's overdose deaths are in the Southeast region. And overdoses were increasing even before COVID-19 hit. And certainly during the COVID-19 pandemic, we saw an even sharper increase in overdoses. And I think that really speaks to some of the structural gaps in care, especially around getting people care, prevention, support, treatment, to really focus on keeping people who use drugs alive and well.
The role that racism plays in public health, it's a systemic issue, right? We see racism play out in education when we look at statistics like the average predominantly Black school district receives less than $2,000 per student as compared to a predominantly white school district. Or when we look at the economy and we see that, or the average white family has $1, in wealth, as compared to 7 cents for the average Black family in America. When we look at statistics across every category, we see gaps. As long as we've been disaggregating and analyzing data by race, we've seen statistics that validate the lived experience of racial inequity in America. And we've seen more acutely that racial disparities are systemically rooted. When we look at the healthcare system, just as an example, one statistic jumps out that says that racism is a public health crisis. The average, on average, Black women die at a rate 2.5 times that of white women during childbirth. And if we look at a lot of other statistics, we've seen them play out during the pandemic. It's obvious that both policy and practice within healthcare is something that needs to be understood and radically addressed in order to make sure that gaps within healthcare are closed.
The partnership is, like I mentioned, is looking to mostly fill in funding gaps and put greater emphasis on racial disparities. And one of the ways that we're doing that is by partnering with Vital Strategies as well as New Detroit. And because New Detroit are really great at what they do, we were able to easily partner with them for this particular work, recognizing that we're all trying to accomplish the same mission, and their current work in health disparities align perfectly with what we were trying to accomplish. So the gap that we were seeing was that it was difficult to find nuanced interactive training for emergency medicine healthcare providers to address both the combination of stigma and implicit bias when, especially when interacting with Black patients with opioid use disorder. And so stigma is when someone views you in a negative way just because of a particular characteristic or attribute, and implicit bias is, unconscious associations, whether they be positive or negative, that can affect our decisions, behaviors, or interactions with others. And because of that, we know that this can have harmful effects when, influences someone's behavior or decision-making. So part of what we were looking to accomplish, like I said, was to find that nuanced interactive training specifically tailored for emergency healthcare providers. And when we looked out at the offerings, we didn't find anything that was specifically tailored to what we wanted. And so that's why we partnered with New Detroit to create this new curriculum. And, an oath is taken for healthcare providers to treat every patient with equity. And there's a certain stigma associated with people who use drugs. And based off of the statistics that we've seen, people are not being treated, unfortunately, with the same level of care. And, the emergency department, it's fast paced, it's quick decision making, and that combined with racial bias and the stigma associated with people who use drugs, it can result in disparities in health outcomes, and that's what we're seeing. And, one thing that we have heard from many of the hospitals that we work with as a major need is, hey, we really need some training to help us around this issue. And, hospitals have shared with us that some patients, when they come in, they weren't being screened for opioid use disorder because based on how they look, saying this person doesn't look like they have an opioid use disorder. So what does that mean? What does an opioid use disorder look like? And also, really educating healthcare providers around addiction, and that it's not like a light bulb, something that you can just turn on and off. And, some of the quotes that we've heard from some of our hospital partners and some of the beliefs that some of the providers may have is like, oh, well, why can't they just stop? These people did this to themselves. Oh, here they are back in the emergency department again. So really working closely with New Detroit to form a curriculum that is going to address all these very nuanced and important issues.
Yeah, so New Detroit was honored to join Community Foundation and the partnership more broadly, because we understand that in order to address a systemic issue, you have to work holistically and you have to work incrementally. And as we focus exclusively on healthcare and realize that it's the policies that exist within the industry and behaviors that exist within individuals, we realized that we needed to have, I would say a tailored and, effective intervention to make sure that, the experience of healthcare is equitable. For some time now before the pandemic, New Detroit realized that we needed to create a tailored tool for healthcare, and we've been piloting the curricula with healthcare systems across Southeast Michigan. And it's called Just Care, and it's a tool specifically to address bias, create cultural competency and awareness, and move behavior among healthcare professionals toward equitable treatment. When we spoke with our friends at the Community Foundation about this, this tool and what we were doing with it, it was obvious that further developing a focus on emergency room practitioners around opioid use was not only a necessary thing to do right now based on some of the data that we've heard, but it was something that worked really well with the tool that we were creating.
Overdoses are more than just numbers. We're talking about people in our communities who are dying of a very preventable issue, a health issue that needs to be treated as a health issue instead of criminalized or moralized. And part of the solution is to address the systemic root issues that lead to stigma, that lead to racism, implicit or explicit within healthcare systems, so that when people are in a vulnerable situation, such as recovering from an overdose, that they receive quality care and they receive opportunities to learn about prevention, harm reduction, and treatment opportunities that could help keep people well. And so I hope to see in Michigan that local philanthropy continues to partner with amazing organizations in the community who do anti-racism work, such as New Detroit, partner with community foundations, local and state government, to continue to fund and support and grow programs that are rooted in evidence to reduce harms related to drug use, but also to support people, meet people where they're at, for those individuals who are continuing to use drugs. And it's still important to keep folks well and alive.
The reasons why people may not be receiving the treatment that they need, and the number one most cited reason, and this was according to the Substance Abuse Mental Health Services Administration, affectionately known as SAMHSA, is that fear of stigma and bias are cited as the main reasons people experiencing addiction may not seek treatment. Prejudice, stigma, and just distrust in general of the medical community may stop, especially Black people, from seeking treatment. And this is rooted in, fear of criminal consequences due to the historical and current repercussions that the war on drugs has emphasized punishment rather than treatment, especially for the Black community. And we do know that evidence-based treatment for opioid use disorder is not offered at equal rates to whites and Blacks. White patients are 35 times more likely to receive addiction medication than Blacks. And one thing I do want to add about just kind of, our hope for the future and, people in recovery, it's important to understand that recovery is not a straight path. Opioid use disorder is a chronic health condition. And while everyone may not be ready for treatment, everyone is deserving of being treated with dignity and respect. And in partnership with Vital Strategies and New Detroit and our other philanthropic partners, we are working to also support harm reduction efforts and really advocate for cultural change to help individuals with opioid use disorder gain access to treatment.
So my hope for the future of the work that we're doing broadly is that number one, my kids don't inherit racism, right? And that looks different from subject to subject, but specifically with healthcare and health quality. I want to make sure that every child who's born, lives in the world we've got today is able to, be a centurion and live to be 100 years old despite their race. And I believe that's possible, if we make sure that the system of healthcare looks at everyone with the oath that they have in mind.